Good evening. Welcome to our Insiders panel. How did you enjoy and love our new mother and baby unit? I'm not even talking about the technology that's available there. I'm not even talking about beautiful settings and wonderful people that work there. The Hudson views, the art, but also the heart that permeates from everything that we do. So thank you for being here. Thank you for always supporting us. Thank you for giving us pride to do what we do and to do more. I know you will love and enjoy our Insiders panel, where our experts will talk about everything that is happening at Phelps around mother and baby. Dr. Gatlak is going to my right. Thank you. You do a great job. Thank you. This is a 6-year project, $24.5 million. A lot of money built in through a community generosity, through Northwell Health System support, through Phelps, our own work and commitment. So there's a lot of people that we need to acknowledge and thank for where we are today. David Seligman, our boss, right, David is in and they're sitting in the back very quietly, but we really appreciate your leadership and support.
Good company.
Our community board, each and every one of you, is here for every event. No one, I can tell you again, no one has a board and support as strong as we do. So thank you for being here and always putting your heart in everything that we do so we are stronger. You saw what our beautiful baby floor looks like. We are extremely excited. As soon as we have the approval from the OH, we will see the babies there and take care of them in the best possible way. Extremely proud of it. Our team is extremely proud of it. Our physicians, our nursing, everyone on the team, because it takes the family to get to where we are. One sentence only, and then I'm going to hand it over, because I know I'm standing between the panel and then refreshments. This renovation represents more than just a physical transformation. It is transformation for the whole experience of giving birth. State-of-the-art facilities featuring private rooms, advanced technology, family-centered design to make sure that we provide the best care not only for the babies, but for moms and the family of significant others. The environment is warm and welcoming. And I think that's what matters the most. Technology, expertise, but also heart.
I love being at Phelps. And I know I'm blessed that I was given the opportunity to join Phelps. It's an amazing community, wonderful doctors, highly skilled expertise, patient-centered care, close to home. We have the human touch. Phelps is very unique in making sure that although we provide highly skilled patient care, we never lose the patient-centered focus. We have cutting-edge technology here at Phelps. Our biplane angiography suite provides us the ability to care for patients with highly complex cerebrovascular problems. Our PET-CT scan allows us to recognize early cancer in our patients. Our MOMS program, which allows our moms to be safe after having a baby, and especially those that have health risks, to be cared in a very proactive way.
The MOMS program is for postpartum moms. It provides a navigator to help high-risk moms be able to navigate their care, making sure that they're doing all the follow-up that they need. I'm very excited about our new Maternal Child Health department. We have a brand new floor. All of Maternal Child is on one floor, and we have big, beautiful birthing rooms with tubs for laboring. We have a new postpartum department that has all private rooms with beautiful views of the Hudson.
We have a lot of plans to grow our Cancer Institute in Westchester. Our sister hospital, Northwell at Northern Westchester, also has other facilities, and that's the beauty of our health system, is that you can get the highest level of clinical care with the most cutting technology across the footprint of Northwell. We have a really committed approach to cancer, which is holistic in nature. So while your body is going through so many changes and experiencing some really difficult things, we want to be able to take care of your mind and your soul and your spirit to be the place to go to receive the cutting-edge technology, the quality of care, the patient experience with the best physicians in Westchester County.
When Phelps invests in its physicians in the community, it benefits everyone around us. We do have access to the Northwell system, but in terms of growing in a way that is in keeping with our community hospital feeling, maintaining the leading edge technology, the community's impact on that is really important.
Phelps is now a hospital that can compete with any hospital in the region, including the hospitals in New York City. We've recruited some great doctors, we have a great staff, we have a new leader in Beata Masterles. So these times for Phelps and going forward are really exciting for all of us on the board. Thanks to the commitment of our partner at Northwell, and thanks to so many of our great supporters who really stepped up and come forward to help Phelps become a first-class hospital here in this community and in this region. We couldn't do it without our supporters.
So good evening, everybody. I'm Robin Gottlock. I'm a family medicine physician. I am the medical director for our outpatient medicine subspecialties. And I'm so happy to be here tonight. The center is beautiful, and we have a great panel for you. Like many of you, I have children. And you probably remember the whole process of labor and delivery is thrilling and also terrifying. And I wish I had a unit this beautiful where my kids were delivered. And I wish I had providers that are this amazing when my kids were delivered. And we get the opportunity tonight to speak to these providers about how they work here at Phelps in this new maternal child unit. So first, I'd like everybody to introduce themselves. We'll start here. Please tell everybody your name, title, and role, and why you like working with mothers and babies.
Hello, everyone. You hear me?
No.
Hello?
They should be on. You shouldn't have to touch a button, but if it's not working,
It's
please.
not working. Hello, everyone. My name's Karen Murray, and I'm OBGYN. I am the chair of the OB department here at Phelps Hospital. I like babies and moms because, when I started my journey as a physician, this is a long story, but I thought I wanted to be a cardiologist. And then I did my OB rotation. And what was nice about my OB rotation was that I got to work with moms and I got to deliver babies. And that's something really special that only OBs and midwives have the ability to do. And I really just fell in love with the field at that point in time.
Hi, I'm Amy Matthews. I'm the Chief Nursing Officer here at Phelps, and my background is I was a NICU nurse, a bedside NICU nurse for about 15 years, and a neonatal flight nurse for 5 years, which meant that I went with another nurse and we went and picked up sick or premature babies from rural hospitals and got them stabilized, did whatever needed to be done, intubated them, put in central lines, put them on medication, and sometimes trained the pediatrician to do the things that we needed to do, and then brought the babies back to a tertiary care. And for me, it's been a part of someone's life story. We get to be there when they welcome new life in and be a part of that. So,
hi. Sorry, I should keep it distant. Hi, everyone. I'm Mazen Khalifi. I'm one of the neonatologists here, and it's always a joy to work with babies and been doing this for 30 years. Every time a new baby delivers, it's like attestation to the greatness of God. And also, I feel I make a difference and bring smile to the parents and see the baby improve. This is joy to all of us. Thank you.
Hello. Yeah. Hello, my name is Judy McCarthy Dalton. I am a certified nurse midwife at the Open Door Medical Center. And quite frankly, I think I'm a midwife because it's the only thing I ever imagined myself doing. I can't think of anything more fulfilling than witnessing the miracle of birth and new families on a daily basis. I can't imagine anything more special. So that's why I think I chose this profession.
Thanks, everyone, for being here. So let's jump right in. First question for you, Dr. Khalife. We just saw this beautiful new center. Why does Phelps need this new perinatal center, and what was the thinking behind it?
I may have a little extended answer. That's okay. No.
I'll turn off your mic after 2 minutes.
So I mean, for people who didn't see Phelps before, they may not see the value of what we have now. This Phelps was built in the 1950s, and nothing had changed in the maternity floor and since 1950s. So imagine, I recall one of the unit secretary, she was born at this hospital 40 plus years ago. She told me the desk when she was born, that the same desk she has now, she's sitting on. So it was really, so it's really needed. That's one thing. The other thing also, when Northwell, our Northwell system, they're a great supporter of us, and we are now, it used to be Phelps, now we are Northwell Phelps. So that's a big difference, So when we started our Northwell team here, neonatology team started, at Phelps, we have the strategic team at Northwell, and Barry's here, and among other, who they surveyed the area. They wanted to see what the needs of the community. The beauty at Phelps here, we serve diverse community. And they really wanted to provide the care and have the access healthcare to everyone. And as Judy knows, she is sitting next to me here, over 40% of our patients from Open Door. So these are underserved population, and Northwell wanted to provide the care for everyone in this community and support them. And they did a lot of research and studies the statistic and the need. So we developed, this is not just a building that developed 5 years ago. We developed different teams. The neonatology team covering here now 24/7. OB are here in-house, anesthesia. We created all the sub-specialty pediatric that will support the care, perinatology. So all of that happened here with the goal to serve this community, to serve the underserved, and to provide access to everyone for healthcare. And in addition, with the hope that preparing for when New York State is accepting a new application for us to allow us to apply and go to the next level and providing care to our community.
Thanks, Dr. Khalife. So let's jump into an example. We've seen this floor. We know what it can do. Let's talk about how it actually benefits patients' lives. So we're going to go and tell you a story of a recent patient experience and what happened on the unit and how we were able to make a positive impact. So to kick off the story, we'll have Dr. Murray talk about this patient, and you saw her first in your office.
Yes, thank you, Robbins. So this is a story of a patient who came into our office for her routine prenatal exam. Not alarmed about anything, pretty much just showed up. During her exam, she happened to mention to her clinician that I really haven't felt the baby move as much. And this astute clinician immediately contacted our in-house ultrasonographer, and we are fortunate to have a full-time ultrasonographer in our office. And so this ultrasonographer just brought her right into the room, and within 10 minutes of her study, she recognized that this neonate was compromised. At this point in time, she basically truly banged on the door of the provider who was seeing someone else and said, "You have to come out now." And when she came out, she relayed that information to her. This patient was immediately transported to the labor and delivery floor.
How many weeks was she pregnant?
She was actually 39 weeks pregnant. Yeah. And she was immediately transported to the labor and delivery floor. But while that was happening, the labor and delivery floor was notified she was coming so our nurses could prepare for her. And then we had a warm handoff from clinician to clinician about the patient who was coming and what they found in the office. So this patient was brought into the labor floor and was immediately greeted by our nursing staff.
Could you, CNO Matthews, go on and describe what the nurses staff did?
Yes. So as the patient came to the unit, she was placed on the monitor with the nurses put her on the monitor. And within 1 minute of the tracing, the nurses saw an absolute flat line, so no variability. And in less than 4 minutes, the nurses had drawn blood, placed an IV, bolused fluids, and had an IV started. So with minimal to absent variability and no accelerations in the strip from the baby, the decision was to conduct a stat C-section from the primary physician.
And tell me, how does a unit make it easier for the nurses to be so fast?
How does our new unit?
Yeah.
It's a really nice space that the nurses can see what's happening and can call for help with each other. And it was a team approach to really, and not just the nurses, the entire team really came together and cared for this mom and this baby.
So the unit was designed for collaboration.
Yes. You can see the entire unit, labor and delivery unit, from one end to the other.
Fantastic. All right. So let's go back to Dr. Murray for a minute. What happened next?
So with the central monitoring that we have throughout our unit, you can see the tracing pretty much from anywhere, the call rooms, the recovery room, the triage rooms, and the physician who was on saw this tracing as well. And she immediately went to the room and quickly assessed the patient and decided that the patient needed to have a stat cesarean section. We're also fortunate enough to have 24/7 midwifery on our labor floor. And I think, Judy, you were the person who was on that day?
Yes, I happened to be on a call that day in the labor floor. And so we do have the central monitoring. So it's easy to see the tracings from many, many places. I happened to be in the triage area and I looked at the tracing and I didn't think it was my patient since I hadn't received any call that one of my patients was there. At the same time, the doctor came into the triage area and I said, I see it. I'm here. Let me know when you're going. She said, I called everybody. We're going. So we got up. I walked in as we went to the OR. She gave me a short report on her patient. I introduced myself to the patient, told her I was going to first assist on the cesarean section, and then we proceeded.
When she called the section, we immediately called for anesthesia, neonatology, who are in-house 24/7. I think Dr. Khalife was the neonatologist on call that day, and everyone quickly came and the patient was rushed to the back. We do have a state-of-the-art operating room. These operating rooms were renovated with our new renovations, and so it's huge and it has everything that we need for our stat C-sections.
So the patient was brought back and had her C-section. And tell us then how, Dr. Khalife, how did you and your neonatal team play a role?
Well, very important preparation in advance and provide timely care, immediate care right away. And when I was told this mommy had biophysical profile 0 out of 8 and flat tracing, so right away we got everything ready. I had 2 special care nurses with me. We have respiratory therapists with us. We are fortunate to have them, and support us all the time. So we got all the equipment ready, medication ready, everything ready, so we don't waste time, because not every minute, every second counts when a baby comes out and needing help. So this baby, actually, this baby came out totally flaccid, barely there is heartbeat, and immediately I started resuscitation, provided positive pressure ventilation, and fortunately, I did not need to give medication because the heart rate started to improve and respond and increase. So gradually improved and the color improved, everything improved. So I switched from ventilation to CPAP, and the baby started to breathe. And the beauty about this also, the parents in those rooms, right? I'm working here, the parents are next to me. So as I'm working with the baby, I'm explaining to the parents, because obviously they are nervous and scared. I'm explaining to them what I'm doing and how the baby responding and all of that. So and later on they expressed how appreciative they were to hear all of this. And before we moved the baby, obviously we can't just leave the baby there. We have to move the baby to the special care nursery area we have now. So since baby is improving, before we moved, I allowed the parents to we brought the baby briefly to them, because that's important for them to just, touch the baby. And and then we moved the baby. We have a transporter for a newborn, which has all the equipment we need. And I moved the baby to special care while providing face mask CPAP. And we have also the oxygen saturation, the cardiac monitor, all of that while we're moving. We are monitoring all of this. And so we observed the baby in the special care nursery for around 3 hours. But before that, once I made sure the baby's stable and, that all is good with the baby at that point, and heart rate, oxygenation, all of that, I went back to the parents in the OR to assure them that baby's continue to improve and doing better. And I brought the father with me to see the baby as well. So he came to the special care nursery area, and he saw the baby. And at that point, the baby was totally off oxygen, totally did not heart rate, oxygenation, everything is perfect. Breathing, I recall it was a girl breathing on her own. And so it was very, joy to the father to see that, and started to take picture. Then he went back to his wife. And when mom came to the maternity floor after 2 hours or so, 3 hours roughly, we were able to take the baby. This baby did remarkably well. It's not always the story like that, but fortunately, this baby did remarkably well because the immediate, care provided with the OB and with everyone, So we brought the baby even to mommy's room, and mommy started to breastfeed, and it was really very, very nice outcome we had, and with the baby and the family, and so it was very nice.
Nope. Yeah.
Thank you.
What a lovely story. And I think it really highlights what we're talking about tonight, which is this new perinatal center was thought up from the very beginning and designed in such a way to help medical professionals collaborate, work together, and help patients. And I think we saw that in this story of the flow and how the mother and baby were both helped in a way that might not have existed before. Well, I want to turn our attention to some other things. I love a good controversy. And I love debunking controversies. I want to talk about a controversy that I sometimes see. I'm a local here. I live in Sleepy Hollow. And I'm online on the Facebook 10591 website. I hear about these mommy blogs. And every now and then I'll see a comment on some of these sites where some woman who's newly pregnant will post and say, I'm pregnant. I'm going to be having a baby. Where should I deliver? And invariably, there's a bunch of comments saying, Phelps is the best. It's right here. It's in your backyard. They have the best providers. You can't go wrong. And I hear a lot of those comments, and it warms my heart because it's all true. But then I hear this little subset of people in the community who say, well, maybe you might not want to deliver at Phelps. Their nursery isn't as advanced. If you have a problem, your baby's going to be whisked away. You're not going to be with your baby. It's going to separate you. Maybe think about delivering somewhere else. And I want to debunk that. And with this new perinatal center we have new things we can do to make an impact. I would like to hear from the participants. Can you describe how this new perinatal center can help debunk that myth about Phelps not being the ideal place to deliver?
Sure. I can start by saying that one of the nice things about this new perinatal center, it will allow us to deliver babies less than 35 weeks and to keep mom and baby together. This is one of the things that's really important to moms and babies. I'll share a little bit of personal information. As a mom, I was the mom of a premature baby. And when you just give birth, to have your baby or watch your baby go out the door and not see them for a really long time, it's a tough thing. I myself once signed myself out of a hospital just so I could go be with my own baby. So, I know firsthand what that feels like. So having this perinatal center really allows us to offer more care to babies and moms, the ability for them to stay together, the ability to deliver patients who may have ICP or for some other reasons need to be delivered before 35 weeks. Intrahepatic cholestasis of pregnancy, sorry.
Thank you. Thanks,
And
doctor.
that will allow them to be able to be delivered here. And then they can stay here with their patients, with their babies. The other thing that we offer is we do now have 2 antepartum rooms on our floor equipped with central monitoring. And what that allows us to do is if we had a patient a few months ago who needed prolonged IV therapy, with the central monitoring and with the space for antepartum care, even though she wasn't ready to be delivered, we could keep her here. We could take care of her. We had a place where she could be. So those are 2 of the ways I know for sure that we can definitely help the community.
Dr. Khalife, do you have some other input on how we can serve these patients?
Yeah, actually, the comment you probably heard on like in the chat, and it's because people, the message did not go out to them, and I think now it's different than before. We used to be Phelps Hospital, now we are Northwell Phelps, so we have the support and the backup of the best healthcare system in the area. So we have all the subspecialists available for us, all the technology available for us. We have, as we said, neonatal team covering 24/7, anesthesia covering 24/7, OB covering 24/7. We have respiratory support, radiology support, pharmacy support, physical therapy. We have all of that. People don't know that when they make those comments. Those who make those comments, they don't know that. If they know that, they will not make those comments. And I think it's now things are changing, and we have a great marketing department. And I think when the message goes out, things will change.
Thank you. All right, I want to talk a little about nursing. So, CNO Matthews, would you tell us how this new perinatal center can help nurses help patients better?
Yeah, so our beautiful, beautiful new floor was designed with patient safety in mind. And if you noticed when you walked in, it's a closed unit. You have to be badged in to get into it. So it keeps our babies very, very safe. And it was designed in a way to have the staff have their separate hallways than the patients. And so it makes a very smooth transition from unit to unit, a very secure and a smooth transition. We also provide an education room for the team to be able to stay up to date with all their education and have a really nice space for conferences, for teaching moments, for the staff to really learn. We also have an outpatient lactation office. And in the future, we'll be able to support the moms when they come back after they deliver, needing some support for lactation. We have the staff have a really nice staff space, their lounge, their locker room. It has just provided a really nice environment for not only the moms with these beautiful views and beautiful rooms, but also the staff that get to have a beautiful environment to take really great care of our families. And something our Maternal Child Health is in North Star 90 for the last couple of years, which means we are in the 90th percentile for patient experience and in the top percentile in the nation for our patient experience for mom and babies for several years in a row, meaning our patients are getting exceptional care and now they get an exceptional environment to also have their babies.
Thank you. And, I understand you might have some comments from some of the nurses regarding their experience on this new floor.
These nurses really love this floor. They're very excited for the new part, the nursery and the staff space. That has a lot of staff space in the new nursery. But I do have some comments from moms who delivered in the vintage unit, and then also in our newly renovated labor and delivery that I would like to read. We had a mom who said, "I loved having a shower that is attached to the room." It sounds pretty basic, but it was In the old space, the shower was out in the hallway, and it was discouraging. The first time that I had a baby, I was in the triage monitoring room where it was tiny. I was sent from my OB's office at 37 weeks. It was my first baby. I was scared and thought the delivery space was so small, and it felt daunting. The third baby she delivered in our new space. The experience was night and day. It was a complete 180. My water broke 24 hours before, and when I came into the triage area, I felt calm, and I felt like if I had to deliver my baby then, it would be a calm and safe space. The nurses were encouraging and coaching, and I felt like the bigger space allowed me to get in different positions during delivery. For my first baby, I stayed for 7 days, and at the end of the stay, I felt claustrophobic. This time around, the room was much nicer. It felt cleaner. It felt more relaxed. The going home meal, in addition to the candlelight meal, was amazing. The Hudson view is magnificent, and my 2 children were able to come see the baby. It wasn't crowded, and we wouldn't have been able to have the visitors in the old space.
What a lovely story. Yeah. Who wouldn't want to deliver there? That's amazing. Great. I want to shift and talk with you, midwife McCarthy Dalton. As we've said before, you work for Open Door, and Open Door is a federally qualified health center that has a special purpose of serving underserved, uninsured people. Open Door mostly employs midwives when it comes to maternal care. Tell me, for you, your patients, how does this new perinatal center benefit your patients from Open Door?
So I've been a midwife at Open Door for 18 years, and I love working there. I love working with that particular patient population. They're just very appreciative of the care that they get. And I think for them, one of the things about coming to Phelps is that the staff here really knows the patient population of Open Door very well. It's a friendly environment. When they get here, I'm sure that many of them are frightened because it could be their first delivery in this country. It could be their first delivery in a hospital. Many of our patients have previously delivered just in their homes, by lay midwives in their village. So a lot of them are frightened. They come here, and I feel like the staff here knows them very well. It's a very friendly environment. It's welcoming. It's warm. We have a lot of diverse population, but we do have many Spanish speakers. And so we have facilities here for language, Spanish-speaking staff. We have the translation line. And so I think that the patients feel comfortable. Also, they feel that they know who the midwife is. They know they're going to be delivered by one of the midwives that they see in the clinic, not somebody that they come in and they don't know who the staff is. They feel comfortable with the person who's going to be greeting them. So one of the issues I think our patients have is transportation. And so I do think that the new NICU is going to help them in that sense, because if they come here and I have to transfer them, it's hard for them to go from point A to point B. Sometimes they get dropped off, or sometimes a family member will drop them off. And then if they get transferred out, the mom goes via an ambulance, then their support person doesn't really have a way to get there. So I do think it's going to be quite helpful in terms of transportation for our patients to be able to stay here in the new facility.
Thanks for those comments. And to reiterate, over half of the deliveries at Phelps are from patients from Open Door. It's a very important population to us, and we're glad to be able to serve everybody. Next, I want to talk about a groundbreaking program that Phelps participates in. It's called the MOMS program. Dr. Murray, could you explain what the MOMS program is and how it helps our patients at Phelps?
Sure. The Moms Navigation Program is a program that was established by Dr. Brown. It started right around the time of the pandemic and was piloted at 3 Northwell hospitals on the island. They quickly saw the benefit of this program. This program came about because patients were going home earlier than they normally did. And so the genius behind this was to reach out to patients after they went home to make sure that they were okay, that they had what they needed, if they needed to have their blood pressure checked or something like that. And within 6 months, they saw the benefit of this program. There was about a 56% decrease in rehospitalization, especially for Hispanic and African American moms. And when we found out about this, we were very excited to bring this program to Phelps Hospital. Through the generosity of our community, the Londons, Judy Cohen, and Robert, we were able to bring that program here to Phelps Hospital. We had a soft launch in April and really launched hard in the end of June. Between June and the end of September, Loretta, you'll be happy to know we had 75 patients registered to the program. Of those 75 patients that were registered, the top 3 diagnoses were either hypertension, diabetes, or behavioral health. And there were about 25% of those that had 2 diagnoses associated with them. So in the Moms Navigation Program, they're reaching out to the patients when they first go home. They reach out to them again like 1 to 2 weeks after they go home. They help them whether it's to call to, reinforce the message that they were given when they left the hospital, to make sure they're taking their medication. If it's blood pressures, to make sure they're checking their blood pressure, and making sure that even food insecurity, that's another thing that's been also addressed by them. So they really just want to make sure that our patients are doing well. I want to just kind of circle back to our story that we talked about earlier. So there are a couple of ways that our patients are taken into the MOMS program. Now, really to get rid of bias, it's really driven by your medical diagnosis. So it's your ICD-10 code that helps you get picked up into this program. So it's, you can also be referred, but it's really based on your medical indication. So that way we cut back on bias. And this other patient that we talked about, the one with the really exciting delivery, I can say exciting because everything turned out okay, right? So exciting delivery, she was referred to our MOMS program, and they did reach out to her to make sure she was doing well. Her depression screen was negative. The baby is breast and bottle feeding well. She has good support at home with her husband and her mom. And so the way they left it is she was going to have a follow-up call in a week or 2. But this is one of the good things that this MOMS program can do, because this particular patient, it was her first baby. So I'm sure she was really scared when she got to the labor floor. And, I actually spoke to them before they went home, because this was it actually was a baby boy. Yeah, you know why I remember it's a baby boy? Because I circumcised him. And so he was able to be circumcised on postpartum day number 1, actually, which was good. And he did well. But it's good to have, follow up with mom and babies and to know that they're doing well. And this is, of course, thanks to this Moms Navigation Program.
Thanks, Dr. Murray. What a nice wraparound program, the MOMS program for our patients. Well, we've reached the end of our time. I'm going to ask one final wrap-up question to all the participants, and that is, what makes you most proud about working at Phelps' new Maternal Child Health Center? Let's start at this end. Midwife Judy McCarthy Dalton.
Long and a mouthful, sorry. So I always have said and thought in my head how Phelps Maternity Center is like a diamond in the rough. I always tell that to people. When people tell me they're going to deliver someplace else, I think, why? I don't understand it. And I think a lot of times they just don't know about the great offerings at the maternity center here. If you're low risk, you can come in, you can walk around, you can ambulate. There's jacuzzis, there's tubs, there's birthing balls, there's showers. It's wonderful. If something happens and things don't go the way you thought and you need a higher level of care, we have our physicians there. They're available to us 24 hours a day. We have a great maternity. We have lactation. I always think that it's such a great place to birth. And I feel like it's just that diamond in the rough that people don't really know about. And that's the way I feel. So I love working here. I think it's a wonderful place to give birth.
Thanks for your hard work here. Dr. Khalife, what makes you most proud about?
I second this? Actually, I second it absolutely. And for me as a neonatologist, and I see how things could go, God forbid, wrong if it's not things done immediately and attended, and how the immediate care and make a difference, not for the moment, for years to come for these families. And so that's very important. So to be part of this new initiative, and that will make a difference in the life of the babies and the family, and for years to come, and improve the care in our community and access of healthcare. That's a great honor to be part of it. Thank you.
Thank you.
I agree. Also, we have such wonderful team. We have highly skilled, compassionate nurses and physicians who love working together and love caring for these patients and being a part of their life event.
I think for me, I came to Phelps in 2011, and I came from an academic hospital. So coming to Phelps was quite a change for me, coming from an academic hospital. And I feel like I came to Phelps and found my inner midwife. It's the tubs, it's the birth in tubs, it's the family-centered care, it's the patient-centered care, it's the patients having a say in how they're treated. It's patients having a say in what happens during their birth process. It's patients coming in with a birthing plan. I came from an academic center. We didn't have birthing plans. So what I like about Phelps is that it allows patients to take part in their care. And with this new center, we can offer them state-of-the-art care in terms of equipment, in terms of our board-certified perinatal team, the closeness of our team. I know if I call anesthesia, they'll be there in a minute, and so patients are happy that they can come to Phelps. They can get their analgesic if they need it. They can be on a birthing ball. They can be in a tub. And to know that once their baby is delivered, if there is an issue, we do have our wonderful neonatology staff right here 24/7 who can take care of them. And, working here at Phelps, and, I live in Rockland and I come to Phelps for all my care. So I drive across the river. I feel that the care here is very personal, and it's personal in such a way that, Phelps is always given back to the community. And one of the uniqueness about Phelps is that every patient who comes here is really treated as a VIP. And so that is really how I feel when I come here as a patient. So I hope our patients feel the same way. And that's why I like working at Phelps.
Can I add something?
Yes.
Also, the midwifery care here, I think we get a lot of patients who'll call and say, I'm looking for a midwife. And so we have a large number of midwives in Phelps, and the midwifery care here is wonderful. And we have a great collaboration between the midwives and the doctors, the physicians here. And that's one of the great things about Phelps, is that they support the midwifery care. We appreciate working with them. And I think it's one of the hospitals that have one of the largest amounts of midwives in Westchester County.
In the Northwell system.
Yes, and I don't know if everybody knows that. So I think that's a really important point, that even though we have a brand new unit and it's beautiful and technical, we also allow for midwifery, low risk, and natural birth, but within the hospital setting.
And I just want to, I'm sorry, Robbins, I'm taking over your show. But I really want to just shout out to Kathy Herons here. Kathy is one of our midwives from the Northwell midwifery practice in Harrison. So I have the privilege of working with two midwifery services, our Open Door midwives and our Northwell Health midwives. And Kathy, I know you should be down here too, but I just want to acknowledge you and let everybody know that you're here in the audience. And I work with 12 midwives. So it's awesome.
Well, that's all our questions for tonight. I want to thank all the panelists for being here. I appreciate your time, and I appreciate all the work you do for our community to make such a positive impact. Thank you, everybody, for your attendance tonight.
Thank you.